What's up, guys? Today we're going to be talking about the pelvic muscles and the pelvic floor muscles. Right now we're just going to be going over the anatomy. So we're going to check out the vertebrae. So we start up at T12, thoracic vertebrae, the lumbar vertebrae, so L1 to L5, our sacrum, so S1 to S4, our coccyx, and then we have our two os cocci, or our hip bone, or our nominate bone. Those are all interchangeable. But really we want to get down into the pelvis, which is a combination between our sacrum, our coccyx, and our os cocci, or our hip, all right, as stated above. Some other landmarks that we really need to know for these pelvic muscles is our femur. So our femur is going to attach into our acetabulum, and that is going to go right into that little ball and socket joint that we have at our hip. So once again, our femur attaches into the acetabulum. We have our patella, which is our knee bone, our fibula, which is our lateral leg bone, and our tibia, which is our medial leg bone. All right, so let's get into the muscles, okay? So we have an iliacus muscle and the psoas major muscle. These are two distinct muscles, and some anatomists describe them as one muscle, but we'll get into that later. Let's just focus on them as distinct muscles right now. So our iliacus muscle, its origin, and that's the main differentiator between the iliacus and psoas major muscle, is the superior iliac fossa, and that inserts right there in that superior iliac area, and it comes down and it inserts onto the lesser truncator of the femur, forming the base of our femoral triangle. All of these other characteristics are shared with the psoas major muscle, such as it flexes the thigh, the innervation is the femoral nerve L2, L3, L4, the arteries is the common internal and external iliac arteries. So these are very much shared in commonalities between the iliacus and the psoas major muscles. So the psoas major muscle, it originates from T12 to L5 vertebrae. It inserts that same area, lesser truncator of the femur, and it's just lateral to the iliacus. Its action is also to flex the thigh, and flexion of the thigh. These are the major flexors of the thigh, the iliacus and the psoas major muscle. The nerve is the ventral rami, L2, L3, L4, and the artery is the muscular branches from the common iliac and abdominal arteries. So that is also a big difference between the two muscles. And anatomists also describe it as there's different strands between the iliacus and psoas major muscles, which make it two distinct muscles, but some will argue that because of the integration of their functions, shared innervation, and common insertion points, it's the ilio-psoas muscle together as one group. So let's get down, let's talk about the pelvic floor muscles, okay? So this is like axial view of our pelvis, and we'll go ahead and talk about our levator ani muscles, which is three muscles formed in this group of shared commonalities, such as the origin, insertion, action, nerve, and artery supply. And then you have our coccygeus muscle, or ischio-coccygeus muscle, which is not a part of the levator ani muscles, meaning it has enough difference between it from the separate three other groups. All right, so let's get into it. So we have our axial view of our hip, or our pelvis. We see our sacrum there. We see our ischium, sorta. So I kind of lied. Ischium is in view, but it's hidden between or behind all these muscles. And then we have our muscles here. We have our pubococcygeus, iliococcygeus, puborectalis, which are a part of our levator ani muscles. So once again, the levator ani muscles share all the commonalities, such as origin, insertion, action, nerve, and artery supply, to where they can be grouped as the levator ani muscles. All right, so in blue, we have our pubococcygeus muscle, and then in that yellow, it's the puborectalis muscle. All right, then we have our iliococcygeus muscle. So iliococcygeus is in that red and orange fonts. Once again, they share origin, insertion, action, nerve, and artery, making them one group, and that describes the three muscle groups, okay? And you can kind of think of these muscles as where they're naming based off the orientation of the fibers. The coccygeus muscle, or the ischio-coccygeus muscle, is not a part of the levator ani muscle, and that's highlighted in green there. Please take a screenshot of the origin, insertion, and action, artery, and nerve, as that's going to come in handy. In a better diagram, so we have our iliacus displayed there. You can see the origin is very much different from our psoas major muscle, which is highlighted now. That's on that vertebrae, and they kind of come all down together. And we'll notice with that insertion that although it's in the same area, the psoas major muscle is just slightly lateral, meaning it's a little bit more on the outside. See that? And you see that the iliacus is just a little bit superior and a little bit more medial. Now we're going to go ahead and look at the pelvic floor muscles. It's very difficult to see in this diagram or any diagram because you have to have that axial view because it's really in that anus area. So we have our levator anus muscle right there, our pubococcygeus part. We do have the obturator internus, but we're going to talk about that in the future upcoming videos. But yeah, this is the best axial view that we could get. And you can really kind of see there all the different strands and how the fibers kind of run differently. So that's a puborectalis, pubococcygeus, iliococcygeus, just as showed below before. But if you guys have any questions, comments, please leave them below. Please subscribe and like the video if you'd like to see more. Thanks, guys.